Hi, everyone. Well, it's AMC Connects again, and very excited to have a special episode where I got a co-host. I haven't had a co-host since I think the pilot podcast, Chuck, right?
I know.
And we're almost like, I think in this episode, going to try host. And I'll explain more after the intro as to why we're try hosting a bit now. And we've got Cassie like right here in the studio, shaped a little differently. We'll explain that a bit more. We're going to talk about the first employee forum because we launched it a little differently than we have in past years. And we're going to deep dive on a couple topics that was, again, pretty essential to make sure that we had co-hosting or tri-hosting. So stay with me, everyone. Welcome back. And in the introduction, maybe for the listening audience, the studio has changed a little bit. Thank you, Chuck, as always, on the promptu. We're co-hosting today with Cassie Winter. If it's not every episode, it's nearly every other that I quote an accolade, a reference point from Cassie. So it's awesome to be able to have you in the flesh, Cass.
Oh, thank you, AnneMarie. You know, it's been a pleasure to be at Rome Health for 28 years now.
Wow.
It really has flown by.
You have seen and done so much, and we're going to go deeper on some of that in this episode. So Cassie's with me, and then of course Chuck is, and hopefully everybody tuned into our first 2026 quarterly forum last episode. It was launched, and Chuck did a great job of making sure that we got it into the time frame.
We made our time.
We made our time, Chuck. We made our time. Well, kind of briefly, what Cassie and Chuck helped me with the first quarterly forum is we talked a bit about shrink to grow a little deeper because we had another month-end report in there. We talked about the pace of healthcare today, which we'll probably talk a little bit more about with Cassie. We talked about CareSync and how we got to the place where we got to CareSync.
Yes.
And we might have a little bit of time to update from Cassie's perspective on how that process is going. Rural Health Stabilization Grant, we want to make sure because it's with us in 2026. And Cassie's our executive sponsor for that particular emphasis and strategic measure that we're working on. First quarter performance, we talked a little bit about, and we gave some pictures of a pre-post area. Some people, I think, on the team are like fondly calling it, what is it?
Pack surge.
Pack and surge.
Pack and
because
surge.
we've aligned so many different services as we've talked about on AMC Connects. And we have talked a little bit about questions and answers that happen in the employee forum. So I was trying to anchor back because we didn't have the time to air it in terms of some questions or confirming thoughts that happened at the employee forum. So maybe I'll talk with, I think one of the questions was around our accolades, Cassie.
Yes.
Yeah. And it was the wound center. And is that really our wound center that recently got an accreditation?
Yes, our wound center does fantastic work. And if you have never had a wound that hasn't healed, you have no idea how tremendous it is when you start to see something close up that's remained open. And so our staff, they received an award, and it was for patient satisfaction and outcomes.
Yeah.
And so not only are we healing those wounds, but we do it in a way with kindness and compassion so that people have confidence and trust in us. And we have a partnership with Healogics, and they recognize our wound care center. It is our wound care center, for clarification. We just partner with them because they have outside expertise.
Yeah, beautiful. Thank you for that, Cassie. I think that was even a better summarized way that happened in the forum. I think another question or thought was when we were going over CareSync, right?
Yeah.
And as a reminder, CareSync was selected as our naming of our EHR initiative. And I think there were a couple employees in the room that were pretty surprised that CareSync, yes, it's about patient-centered care. It's about clinicians having an easier tool, but it's also about support services, right?
Yeah, it's definitely about support services and efficiency. You know, when you're looking at an EHR, very often we think in terms of the clinical services that we are providing and how we're documenting and all of those components that help us deliver care and get paid for the care that we deliver. But an EHR is a monumental system, and it affects everything from analytics so that we can see and measure the care that we're delivering and identify trends so that we can take the next step in improving our care. And right now, there are folks in our quality management department, they don't have a lot of tools.
Right.
They do a lot of things manually. And so they were ecstatic to hear that analytics was one of our guiding principles in terms of when we were evaluating different systems, that we need to have one source of truth.
Yep, and that maybe we could lessen their workload and they can help support decision making instead of data mining. Great summary, Cassie. And I think shifting gears a little bit, Chuck, right? Maybe we've had the mailbag open. Well, it's been open, of course, Chuck, right?
Can I just say, it's about time.
It's about time. Cassie appreciates that too. Tell us what's going on with the mailbag, because that was pretty quickly after.
We got a mailbag thing. So let me pull it up here. Look at it. I got it on my phone and everything. So it says, good morning. I wanted to send a note. Well, I'm going to turn it sideways so I can read it better. There we go. So a note that I'm enjoying the new set for AMC Connects. The background with some personal items, the famous pom-poms, and various awards make an eye-catching and comfortable scene. Well done, Chuck. That's right. I especially enjoy seeing the miniature pig with wings, reminding us all that we can do hard things and succeed. As someone who took a detour from Rome Health and who has been welcomed back, I appreciate the transparency, the honesty, and the desire to work with integrity, compassion, and a healthy dose of humor. That's right. So thank you for producing and publishing AMC Connects, and thank you for all you do. Take care and be safe, Kristen. Kristen, thank you so much. We appreciate it.
Thank you. We're going to give her.
Oh, you get a pom-pom. Yay!
And not just because we love Kristen, of course, for all that she brings to Rome Health, but because she made sure, Chuck, that the mailbag actually worked.
I know, right? It's still connected. I was getting nervous about that, but it's still online. You can still send it at amcconnects25@gmail.com. I still got that. That's right. So send them in.
Well, Kristen, thank you for the compliment. Chuck certainly deserves that. Me and Cassie were just commenting, and Chuck, as always, he was throwing compliments back to Cassie, but I shared this on one of the episodes. And so when Cassie, being in the studios here, I said, I had this vision in my mind. I love working at Rome Health and love working with people like Chuck. Certainly we'll get in a little deeper with Cassie, that I don't know how they do it, but they read my mind, and it's far better than I could ever accomplish, right? So the staging, but Chuck had said, Cassie helped with that too, because I was throwing in some things. So,
well, the thing is this organization is a team sport. That is really the reality, is that no one individual in this organization can do it all or thinks they can.
I know, I love that part of our culture, right?
So it really makes a difference when you know that you don't have to have all the answers, because somebody else is going to help you brainstorm and get you to the right solution.
Yeah. Oh, yeah, thanks, Cassie. And I really appreciate Kristen kind of echoing the when pigs fly. I could bring that right down. We're going to talk and open it up a little deeper with Cassie, because some stakeholders, a key stakeholder had said to me once, and I referenced this on an AMC Connects when we were displaying the new studio here, that when they heard about the big bold plan here at Rome Health several years ago, they gave me that stress ball in the shape of when pigs fly, because they were interested, but they said, these things will be accomplished when we see pigs fly, which I thought was great humor and took that in and had kept it close to me as a humbling reminder that when you have bold vision, it can be something that can be a stretch for sure. But I'm so honored to be next to, which I get to do often, but all of you don't necessarily get to be next to Cassie Winter. We also phrase it because of her in that she helps make dreams come true. So another word, when pigs fly, could be when dreams come true. So Cassie, tell us formally what your position is for the organization and how you make pigs fly or dreams come true.
Well, my official title is Vice President of Communications and Grants Administration. But really what that means is I tell stories. Mm-hmm. And I am the chief storyteller for the organization in order to keep people informed, to let people know the why, mm-hmm. because it's in framing the why that we're able to help people understand where we're going, mm-hmm. why we're going there, and what we hope to accomplish. And so when I took over the grant responsibility, one of the reasons why I have been so successful is because I've been part of this team for so long. Yeah. And knowing what the vision looks like, mm-hmm. then I can relate that vision to a grant application. And I have amazing stakeholders that I partner with, mm-hmm. and they are able to say, this is what I want to do, Cass. Yeah. How are we going to do it? Mm-hmm. And I need this much money to make it happen.
That's the pig. That's the pig. Or the dream.
Yeah, so, it's like we have been amazingly successful over the last several years. I think because we have been able to paint the picture of what this is going to mean to our patients, to our staff, to our physicians, mm-hmm. to our APPs, to our elected officials. It's the dream becomes a reality because it's framed in something that can be and that should be.
Yes. I was so grateful. I'm so glad you told everybody how long you've been at Rome Health and the role you play both formally and then maybe the style you take to it, like storytelling. I never asked you this question, but I've always been so appreciative of you, obviously, or you wouldn't be quoted so much on AMC Connects. But I think one of our first meaningful conversations was when we were first kind of learning about each other, because I didn't know you well before mm-hmm. I was the CEO or really at all before I came to Rome. And I remember you kind of hearing a little bit more about me and how I want to stay close to what's going on and learn the community so well, which you were just an incredible asset to. But we talked about feedback from the community, and you had informed me, the way I remember it, is Cassie had informed me that a lot of the feedback coming in through the organization, the manner with which it wasn't positive. And so how to keep track of that. And I said, Cassie, I need you to monitor everything because I need to know everything that comes. And you said, are you sure? And I said, yes. And I want to work with you and entrust you to tell me what really needs to be known and reacted upon very quickly. And then we have a little bit of time. Or how did that feel? Like I'm looking back and just looking into your beautiful face. That was a lot of pressure. It was a lot of pressure.
It was refreshing because you have to understand, I've been here for 28 years. So I was hired because the hospital had a media relations issue. They had a reputation issue. I didn't have any marketing experience, but I was a reporter for 7 years. Mm-hmm. And so being able to understand what our community feels and then being able to translate that to somebody who can do something about it is very important. And I think back to when we opened the medical center and the challenges that we had initially. Mm-hmm. So we put KPIs in place so that we could actually make change. We were listening to the people out on People and Places and Opinions of Rome because their opinions matter to us.
That's right.
If that voice starts to get loud, we need to be responsive of it because it actually means something in our system is broken.
Yes.
We need to measure it, we need to fix it, we need to monitor it. And so that was a very great responsibility to have.
Oh, great. And you were ready for it.
I was ready for it.
Because we've understood the community, I have, quickly, I think, in a unique way because we've had you and because we've had those pathways to be able to be really close to people's opinions, to your point, right?
I think you, being from outside the community, understood that intrinsically as well. I mean, from my perspective, you know, it's like Rome can be a hard place for people who come from outside the community. Sure. Well, how can you know Rome? You don't live here. Yeah. And so I would ask you, you know, coming from Syracuse, you spent your entire career there. Yeah. How did you know that you had to approach Rome differently than Syracuse?
That's a great worded question, Chuck.
Yeah.
Good luck.
I know. How did you know? I think it starts with a deep desire to really understand people. And you said the word trust or entrusted responsibility, that healthcare and meeting people's physical, social, mental, emotional, sometimes spiritual needs comes from a deep place of individualized care. So if you believe to create the best healthcare experience, we really need to understand each other on an individualized level. Then I think that's probably at the core what it was. And being, you know, in a community that was close knit. And what I love about Rome, and desperately wanted to be an adopted Roman, I thought so highly of this community because they were like fearless. Yeah. We're fearless and have high expectations. And I wanted to be a part of that. I want to be a part of a city, of a community, of a county that has high expectations. And some of that is intolerance into what healthcare needs to look like for them personally. And so could we create an ecosystem within our network that could meet such high expectations? So it was, did I answer your question, Cassie? I mean, it's just kind of kept me so engaged and like an energy was really sparked.
It really is coming back to the reason why you serve. Bottom line is, whichever community you serve, you need to know them to serve them.
Yes, yes.
You know.
That was a great question. I think, like, pivoting a little bit, Cassie knew when it was time to, like, have a Chuck. Let's talk about, how did we get Chuck?
So Chuck had done some work for us as an outside vendor. Yep. And so we were doing some commercials out in the community, and Chuck was just great to work with. Yeah. You know, he would come in, he would make people feel comfortable who didn't feel comfortable in front of the camera, and he would produce good work. So I was a solo practitioner and I needed some help.
Yeah, people might think we've got a whole like department of communications, right? Well, we do, but it was one. Now two.
And so I had obviously advertised for somebody special to join my team. And I needed someone really who had the video competencies because we know where social media was going. Yeah. And for me to buy a 30-second ad was going to cost me upwards of $5,000, $10,000 for each 30-second spot. So I wanted internal talent. And I don't know, Chuck. You know, what do you think?
What do you think about being
I was just kind of going, I got a notice from Indeed just on my phone, and I was just like, Rome Health. I'm like, let me look into that and see what was happening. And I was like, it's Cassie. So I was like, heck, I'll just send it.
We love the honesty.
So it's just like, I'll just email Cassie and be like, hey, I know you want me. So here we go.
I love that. And it shows, right? But I think, Cassie, too, what was threaded in when you came to me, because we're always working towards making sure we've got ROIs on everything, right? So you had the ROI, you had the humility. Yeah. You had to share with me, well, this is a skill set that we desperately need, and I don't know that this is my greatest skill set, right?
Right. You have to hire for your weakness. If you hire somebody who is like you, then you still have holes in your department. Yes. And with a department of 2, I can't have any holes.
Right, Chuck, what a compliment. What a compliment, for sure. Well, thanks, Cassie, for that deeper dive. Going into some high priority topics. We say often here on AMC Connects that we've always got some construction going on, but recently we launched phase 3 construction. And I was giving credit when it was coming, right, Chuck? That it was Chuck that released it. No offense, Cassie, but Chuck's like, no, it's Cassie. It's Cassie. So Cassie, talk to us a little bit about the phase 3 construction, because we do have some wayfinding that changed up a little bit.
Sure.
And maybe Chuck will flash up the map for us while you're
Yeah, that would
talking.
be- nope. Okay. So
Not going to do it for
not
you.
gonna do it. All right. With phase 3 construction, this is exciting because this is actually the support space for our team members who are working in the new Kaplan Center for Surgical Services and our new PAC and Surge, our actual preoperative and postoperative procedure rooms. And this is going to be the space for their locker rooms and such. But we have to do some construction up in the ceiling. And so we have 2 corridors that are closed. And so anybody coming through the emergency department, if it's our staff, they're going to have to go up or down to go over. So it's about 9 weeks for them to do this particular work. The entire phase 3 project should be done around September. And then that will finish this construction project.
Can you believe it?
No, it's amazing to see how fast, when we talk about pace, to be able to bring this entire project to fruition when you had to stage it.
Yes.
There were so many different moving parts because we had to build something before we could take our old OR and PACU out of commission. We had to build a temporary PACU. We had to build temporary lounge and changing rooms.
Yes.
So all of this had to be staged, and it was just so amazing to watch it come to fruition.
Yeah. Thank you for keeping us up to speed, Cassie, and for the wayfinding. And we have lots more work to do, hopefully, in the near future on wayfinding. You and I have been waiting, watching, a lot of temporary, as you said, but we're looking forward to someday getting that a little bit smoother out. But we have some good temporary plans, and so thank you for that. Yeah. Shifting gears, we did get Cassie, guys, friends, Chuck, like, wow, right? Cassie got a surprise that she was able to late last week kind of talk to me about and get some comms out there between you and Chuck. Tell us a little bit about what a great place Rome Health is to work at.
Yeah, well, like I said, I've been here for 28 years, so I'm a little biased, but Newsweek recognized us for something that I already know, and that we're one of the greatest places to work in American healthcare. And so it was not an award that we applied for. It was based on online sentiment surveys, that type of thing. So it was our employees that they discovered, said, Rome's a pretty special place. Very, very special place.
Yeah. And
culture.
Yeah. Like, what do you think some of the components were that triggered, being able to receive this, and maybe some of the feedback that you noticed directly that probably, because it's proprietary, I'm sure, and we don't know exactly, but that led to this particular designation, and what did they see from us? Like, what do you think, Cass?
I think there's a few core things. One is a commitment to professional development. And so when you look at our organization, we have tuition reimbursement. We invest in people with their certifications. We have transitions to practice programs so that when people come on, we can help build their confidence. And we give people opportunities to completely change careers if something's not right for them, or to rise up in the organization. People may not know it, but half of our executive team is actually from the front ranks. So you've got Scott Burns, who was a staff pharmacist, Ashley Edwards, our chief nursing officer, who was a GM that started at the hospital. It's like half of us started here and grew up. And so there's a connection in that space, because I think we as an executive team recognize that the best information comes from the front lines. And that really is what makes us unique, is that we trust our employees to tell us what we need to know.
Yeah. And we've talked about this a lot, but it's like one of the most favorite parts of my culture, our culture at Rome Health, the team, and that we don't just take it in. We depend on it. We depend on frontline information to make decisions, right?
Yeah, definitely.
Thus the mailbag, people.
But
mailbag.
But I mean, it's evidence in everything that we do. When we built the Kaplan Center for Surgical Services, we didn't depend on just architects in a vacuum. Our front line was at the decision-making table, helping us to design this space so that it worked for them.
Yes.
You know, we built mock-ups in the garage so they could go through it, and it's like, yeah, that outlet's not going to work for us. And so giving that kind of feedback in terms of work design and how can we really make this a patient-centered and a physician clinician-centered space.
Yeah.
And you know, you see that now as we're going through our CareSync selection process. You know, it was so exciting to see how many people were in the classroom for our day in the life yesterday. That classroom was packed with people who were looking at the system and providing their feedback that we're going to be able to use in our decision making.
Yes. I just had a physician stop by and tell me before I came over to have this deeper dive discussion how impressed they were with the process. Like even structurally, right? Nancy, Dr. Artilio, the executive team, you always have your eyes and ears out there of how can we actually construct the process where we don't just say that we need that frontline thoughts and feedback, but that they actually have that opportunity to participate in the process, right?
Yeah. And that's very important because if you just throw an email out there, you're not going to get the response. We know people are busy. You have to lean in order to get that kind of participation.
Right.
And you have to have built up that trust that they know that their feedback is going to be important. Otherwise, that room would have been empty.
Yeah, that's right. That's right. Yeah,
You know?
that's cool. I think that was one of the questions at the employee forum too, was our CareSync process, how we were going to make sure. And you had made sure the room reminded that we were going to have a day in the life.
Yeah.
So we had like individual like value stream sessions and workflow demos, but we also had the day in the life. Well, Cassie, our time goes by so quick, doesn't it, Chuck, here? I mean, it's just like super fast. What would you say you're most excited about the future of healthcare and how that is with Rome Health? Or what would you say is maybe what you're worried about? If you're worried about anything. I always feel like you're so balanced, Cassie.
Well,
what should we be mindful of?
I think the most exciting thing for me right now is really the EHR. We've done so much with our physical plant to improve the physical space. We have increased our physicians and so that we have greater access to care. So we've done so much, but even though we have growth, we have revenue, we still don't have margin yet.
Yeah.
And so that's the worrisome part. But I think with the EHR, we do have the ability to finish that vision because there's so much inefficiency in healthcare, and this provides us with that avenue to close the gap.
Yes.
You know, simple things like the dual registration. People may not know that our registration clerks have to register patients in 2 separate systems.
Yes.
So that's duplicate work. Our continuum of care staff have built manual tools to track our patients to get through the system. That it's manual work.
Right.
And so I think when we have our new EHR in place, that we're going to, as you say, eliminate a lot of this white space that doesn't do anything to contribute to the delivery of care.
Yeah.
And so that's what excites me is in this next 2 years, so 18 months from the time of contract. But after that 18 months, once we're live, that's when we're going to find all of these operational efficiencies that will make healthcare more sustainable for us.
Yes. Yeah. I'm so glad you're excited about it. It's not it's space you've covered before, from a comms perspective over the years, but how does it feel to have it be like a reality? Because Rome Health has studied what the right solution would be for some time. How does it feel to like be here, Cassie?
It's very rewarding. Very rewarding. I think back to my first days at Rome Health. And at that point in time, it was a very pivotal time. The hospital was 3 years post-privatization. There was still a lot of controversy in the community. And we were starting to do good work, the pace of that good work has accelerated since 2020 because of the ability to access resources.
Yes.
The grant dollars that we have been able to secure really has enabled us to accelerate that vision. So whether we're talking about virtual nursing that was funded by the Cabrini grant, we wouldn't have been able to embark on a lot of these things because there's not margin in healthcare to make those investments. And so it is rewarding to have been able to make our dreams come true.
Yes, yes. Cassie, thank you for co-hosting. Chuck, as always, thank you for try-hosting.
Oh, no problem.
AMC Connects. Chuck, do you have any updates or thoughts or questions now that we've got Cassie all to ourselves?
No. I mean, it's so informed. I mean, it's, you know, I have the gist of always what's going on. And if not, guess what? Cassie, got a quick question. She knows my little knock. I have my little knock that I always have on our door. It's just a light little, and she's like, yes, Chuck.
Yes,
no, just kidding.
I don't sigh.
No, she doesn't do that at all. No. It's me more like, oh, I got a bugger. Here we go. But no, it really is the communications between everybody and us. We're always, and it's like, not like it's perfect. We're still working on it, but you know what? I feel we do a really good job overall, especially with AMC Connects and just things like that. I mean, I walk in the hallway. I know we kind of joke about the mailbag and things like that.
Yes.
But I mean, I walk the hallways and there's one person, I've told her a million times. She's like, I just saw the last episode. Oh my gosh, it's so great, AMC Connects. I love that you guys do it. And I'm just like, please just send a mailbag thing so we can talk about it. And she continues not to. So you know who you are. So the mailbag's open, AMC Connects 25@gmail.com.
Yeah.
But yeah, so, you know, but I mean, the communicate, it's really, I think this is just a great way to continue to keep the word out on what's going on lately at Rome Health.
Thanks, Chuck. And, you know, I think Cassie was a great host to be able to emphasize. I say it a few times, but Cassie worded it, I think, even, you know, a little bit more specifically, that there's a dependence on the leadership team to hear from certainly the community. We touched on that, but our internal community, which is our workforce. And we feel like we're flying blind, especially when we've got a lot of vision, a lot of needs to be able to work through, that we orient ourselves around feedback. So I really like that Chuck always gives some levity to the mailbag, and that's just one avenue. You all are working a few avenues to be able to give us feedback. So, you know, thank you again, Cassie.
Yeah, absolutely.
And people can tell us what you think about the co-hosting side. And this is a really neat summary. The Chief Storyteller. I don't know that anybody's got that title, but Cassie has a formal title, as she said, but the Chief Storyteller, and have that linked to our success, the way you described it, Cassie, is just so neat. So thank you. And thank you for taking us through a few priorities. And we're definitely going to probably co-host again on a couple topics, but when do you expect that the rural health stabilization information will start coming out? Because as again, you're our sponsor for that. So it'll be nice to walk through it.
That's very exciting. Right now, they're doing a deep dive into our operational and financial data. Once then they will actually come on site in May and interview our directors and frontline staff, because they want to know what the data is not telling them.
Yeah.
What's really broken.
What's the truth with a capital T.
Absolutely. And then in July, we'll get that report.
Great.
So that they can summarize for us, where are our opportunities? Because you and I know rural healthcare is a challenge. The reimbursements don't keep pace with the cost of providing care. And there are just some intrinsically difficult things about being a rural healthcare provider. But they're the experts. And so they will give us nuggets, and we will come together as a team in order to actually identify a working plan, in order to identify where can we improve our efficiency, where can we expand our services, things that are within our control. You know, there are a lot of things that are outside of our control in healthcare, but this gives us some control back in order to see where are we going to put our time and efforts. I would say that one of the reasons why we've been successful in the last 6 years particularly is this focus. you know, we can't do everything all at once. You have to have a focused plan on a few key priorities in order to be able to move the needle.
Yeah, yeah. Well said, Cassie. We're gonna be able to know more and hear more. Cassie gave us the time frame. So I hope everybody's enjoyed the change up here with AMC Connects and spending a little bit of time with Cassie. If you haven't met Cassie, now you have, if you're tuning in. And I'm one of those people like Chuck is knocking on that door, and Cassie welcomes that. She's kind of the truest picture of open door policy I know I've ever seen in a leader in every way possible. So she welcomes that. So certainly don't hesitate as another leader to reach out to if need be. And in closing, thank you, Cassie, for all that you've done over so many decades here. And we look forward to having a deeper conversation over the next set of priorities. So thank you, everyone, for creating the best care out there. Here.
Here.
Yes.